Hello and welcome to PlasticSurgeryTalk.com. I am Dr. Stephen Mulholland here in Toronto, Canada, your host for the show. Hair. Not the removal of hair, not laser hair removal, but the growth of hair. One of the most common things done by men on the planet, bringing back full, luxurious, natural hair. Women. Over 50% of women over 30 years old complain of thinning hair. Yet the thought of hair restoration surgery or hair transplantation doesn't appeal to them because they don't like the thought of the scar, the long scar at the back of the scalp that we have traditionally used to transplant the hair from. Well, good news. For thinning females and balding males, there is good news. It's called NeoGraft. NeoGraft hair transplantation, taking little follicles, one little hair at a time from the back and moving it to the front, borrowing from Peter to pay Paul. As long as you got a full bank, you can have a full luxurious head of hair without the big scar at the back. Let's take a look at this Plastic Surgery Talk story.
Good morning. We are back at SpaMedica with Dr. Stephen Mulholland, and this is very interesting. We've just been chatting off camera. We're doing non-surgical medical procedures this morning, and we're doing hair transplantation right now. Right. And I am finding this fascinating because we did a show before and they actually take a strip of skin from the hair and then they transplant it into the head. But you say that you're not doing this. What is this called?
Well, strip grafting was very common before. You take a great big cut out of the back of your scalp and then you cut all the hairs up into little hairs and put them in the front. This is the blessed area. Now we do what's called NeoGraft.
The blessed area because this is where all the hair is.
And it never goes away. So we take this little device, it's called the NeoGraft hair transplant system, and we go into the hair and we take a little piece and we suck that hair up into the cylinder. So now I've got a hair living in the cylinder.
Oh, there it is.
I do that about 500 times. Now, our Dylan, our patient, has short hair today. Normally, very long hair will cover over that area where we take it. These little tiny holes, hold this, Dylan, for me. They heal on their own. There's no scar, no cutting, no stitches. Then what we do, once we've taken the hair, we take our little transplanted hairs. These are the ones that came from the back. We didn't have to make any cuts to get them. We harvested them one hair at a time, like reforestation, taking little seedlings, but no strip logging. We take these little guys, and here is a little family of 3 hairs that live together.
Oh, it's a little family. It's like making babies.
If you look at the back of Dylan's hair, Dylan had bald patch at the back.
Yeah, he's already had a treatment.
He's had one treatment, and again with nice growth. And we take this little hair, and we simply insert it down into the little slit that I made. And as you can tell, I do not ever shave the areas where we're putting it. So we don't shave where we're putting it, and we insert it into its little home. Voila.
Wow.
Now we do that 1,000 times. So it takes 3 or 4 hours. There is no cut at the back. You can go out immediately with your hair covering the little holes that we harvested from, and no one's going to see the front because you've got hair covering it. Now about 60% of women over 50 years over 50 have thinning, like a pie-shaped wedge at the front.
So women can get it too.
Absolutely.
Okay, you know what?
Absolutely.
Very quickly, because we've got to go back to the station. First of all, how many treatments will somebody like, it's Dylan, right?
Yeah, Dylan. You could do 2,000 little hair family sessions and you're done, or you can break over 3 or 4 smaller ones.
Okay, and how much is it going to cost roughly?
All told, hair transplantation between $4,000 and $8,000, depending on how many hairs you need.
Wow, this is so cool. Thank you, Dr. Stephen Mulholland. Back to the station.
Wow, is that not cool? Restoring hair, one hair family at a time. NeoGraft, automated follicular unit transplantation, a fancy way of saying we are now doing seedling transplantation, taking little hairs up by the roots atraumatically, inserting them naturally and attractively in the areas that you have that are thinning. No more strip logging. NeoGraft is changing the way hair transplantation is done. So if you're thinning, female or male, please check for a physician on our PlasticSurgery.com physician finder here on the website and find a NeoGraft trained and certified physician near you. If you happen to be in Toronto, come in and see me. Thank you for watching PlasticSurgery.com and stay tuned for more interesting and compelling shows.